Welcome back to Viewpoint. Tonight we're focusing on the critical care unit. We have footage taken by the GHA in recent days on a body cam. They took care to ensure none of the patients are identifiable. There are sadly as yet no cures for COVID-19, but for those who get infected and are harshly hit, treatments are improving. The Clinical Director of Intensive Care and Anaesthesia, Dr. Hamish Thompson, told Viewpoint an anti-inflammatory medication called tocilizumab is helping when given early, and steroid treatments are also proving beneficial, though they do also suppress the immune system. Treatment of blood clots is improving, and turning patients onto their front is also proving beneficial for those who have had to be ventilated. The extensive personal protective equipment seen in these images initially complicated basic communication for CCU staff, but they've now got used to it. Some of them have themselves been infected by coronavirus, but have returned to work as soon as possible to continue working very long hours, an intensity of work which Dr. Thompson told me has had an impact on family life for these medical professionals. Can you describe in very basic terms the different skill sets that exist within critical care doctors or intensivists, nurses?
Yeah, so ICU is very much about trying to normalise the functions of a body that is failing. So we focus on getting adequate oxygen levels into the body. We have all those various devices I explained before, Optiflow and via ventilation. Once you've gone onto ventilation, there's various things we can do. We obviously have to put a tube down for the breathing. We have to insert various lines to support blood pressure. We have to occasionally put patients onto kidney machines if there's kidney failure. So it's really individual organ supports of each failing organ. While the antibiotics and the drugs and the other treatments we're giving kick in, all the patient starts to recover by themselves. And we have been fortunate that as time progresses, those treatments of COVID have become a bit clearer. There's still some uncertainty on exactly the best way to treat it, and there is no magic bullet. There are no cures for COVID, but we have more medications in our armoury now than we did at the start of this, and a clear idea of what works and what doesn't. And there are certainly some of the treatments that have come through that we've seen some pretty good results with, namely one of the newer agents, tocilizumab, we've been using. It is a drug with its own significant set of side effects. It's an immunosuppressive agent, but seems to help if given early in stopping progression to severe respiratory failure in some patients, not all patients by any means. There's definitely a benefit to steroids, but again, steroids suppress the immune system, so they do lead us to other problems in the future, like secondary infections. And we're getting clear ideas now as well how to deal with the risk of thrombosis of clots in COVID. And I say there are new treatments and new ideas coming through all the time. Mm-hmm. One of the other things that has proved to be very effective in keeping the oxygen levels adequate is proning. You'll have seen that in other media outlets, mm-hmm. turning the patients over onto their front. That's something we do routinely if somebody goes onto a ventilator. We'll do that in cycles for 3 to 5 days, and then longer in some patients. And that's been very, very effective in keeping the oxygen levels safe in our patients.
In very basic terms, they find it easier to breathe when lying on their chests.
Yeah, so those patients, you can do it fully awake, what we call self-proning, and that does improve the oxygen levels, and the people sometimes feel it easy to breathe. But once you're on a ventilator, we do it for you. We turn the patients over. And because of the way the lungs are affected, they're not affected uniformly throughout the lungs. Because of that, when we turn them, the blood supply is better to the better parts of the lungs, and the oxygen levels improve for that reason.
How difficult is it, or how much have you had to adapt the way you do things and how you do things to be able to do your jobs in full PPE to the extent that we are seeing in the images that you're showing with us?
Yeah, so that was a quite a rapid learning curve. When you first go in, it feels very different. It's uncomfortable, it's hot, and voices are muffled by the masks. And when we started working in PPE, that was a problem. Communication was a problem. The general situational awareness thing was quite different. It's remarkable how quickly you adapt and how quickly it becomes normalised. I guess the analogy is mask wearing. If you go back a year, none of us would think it was comfortable to wear a mask every hour at work or when we're walking down Main Street every day, and yet we do now without a thought. And I don't know if you do the same thing. Sometimes I find myself at home watching TV and I've still got my mask on. You almost forget about it. And the PPE is like that. The respirators we use are like that. When you first start using them, they feel very cumbersome, very uncomfortable, and then very rapidly adapt to being a normal part of your working practice. When you're doing a lot of procedural stuff, when you've got a very sick patient, it gets very hot. That's the only thing. It does get very hot in there, but there's worse things.
And you're doing 12-hour shifts?
So the ICU doctors, when we're doing the COVID ICU, we're working from 8 a.m. until the end of the handover, about 9 a.m. The consultants are also doing on-calls through the night.
8 a.m. to 9 p.m.?
9 p.m. The consultants are also doing on-calls through the night. We've doubled the cover for those on-calls because they can be very busy, so there are 2 consultants now on call. And usually after you're doing the first on-call, which is the person that all the calls will come to, we usually try and give that person a quieter day afterwards, because it can be quite onerous overnight to work the full 24 hours. The nursing staff again are working 12-hour shifts day and night. Our junior doctors are working the 12-hour shifts as well, slightly more than 12 hours because there's a handover before and after. And that's it's a big burden, and obviously we've had to quite significantly increase our cover at night because we have so many sick patients within the hospital and we're trying to cover 2 different ICUs. I think that's we've all accepted that leave doesn't exist. Our personal lives are a bit on hold. Our families are taking a bit of a toll with that, but it's part of the job.
Well, I think it's an appropriate moment. I'm sure a lot of our viewers will be wanting me to thank you on their behalf for the care that you are giving people in intensive care, but elsewhere in the GHA, in your capacity as Deputy Medical Director. If I can, Dr. Thompson, I've got one more question, and it's just if you are sort of in the middle of the busiest period of the pandemic, or maybe hopefully coming out of it.
Yeah.
Are you at all aware of the place that these months will have in a broader historical context? Do you think about that at all? I mean, because we heard the Chief Minister, for example, talk about January being the worst loss of life that Gibraltar has experienced in 100 years from a single cause. Is that on your mind at all?
I think so. I think one thing that definitely the ICU team felt during the early part of this year was that we were incredibly fortunate to have been hit so lightly. It felt surreal. We had expected this to happen. So in a way, I think we were prepared that we could be hit like this. We'd seen colleagues in hospitals we'd worked in experiencing this. We'd spoken to them. We'd seen Spain hit very hard from my Spanish colleagues. Their own previous hospitals hit hard. My own previous hospitals in the UK experiencing this. So I think we knew that it would happen. And I think while it is historically a unique event for Gibraltar, it's a historically unique event across the world. And I guess we will only really, while we're still in it, while we're still doing it, it's hard to really reflect or answer that question until we're on the other end and looking back on it. I guess the other thing we have to be aware of is we don't know where this goes, where COVID ends. The immunisation strategy in Gibraltar has been world class. Our lockdowns have been very effective at getting us out of this, but whether we still have problems with this virus going forward for the next year or two, whether there are mini outbreaks, whether there are more issues with it. And then even when we get out of this immediate period, from the hospital point of view, we have a lot of work still to do. We will be dealing with patients with repercussions with COVID, and we will be dealing with a backlog of our normal work that has had to take a back seat during this. We have tried very hard to maintain the key services, cancer care, cancer operating, all the way through this. Even at the worst times, we've still been doing those operations and trying to deliver chemotherapy and all those other services. But we are aware that there's a lot of less urgent, but still very urgent for the patient surgery that has had to take a back burner. And once we get over this hump, our next job will be to try and deal with those backlogs.
But we don't know how soon that'll be.
No, and it is, unfortunately, I say one of the issues is that while the rest of Gibraltar is coming out of lockdown, while the numbers in the community are dropping off, because of the nature of COVID and because of the long COVID issues that patients face and the very long recovery of ICU or very sick hospital patients, we still have a very high burden on our unit. We were still putting people on ventilators this week, even though we're coming out of lockdown. So we're seeing everything that was happening 10 days ago is still our reality, or 10 days, 30 days ago is still our reality. Whereas the community, thankfully, can start to come out of the lockdown.
Because it takes approximately 20 odd days between contracting the virus and experiencing at its worst.
It's about 7 to 10 days.
7 to 10?
7 to 10 days is usually when we start to see patients come in with the respiratory complications of COVID. That said, those complications can occur, or other types of complications can occur weeks after the COVID infection. The lungs, for some patients, don't return back to normal for long, long periods of time.
For somebody who's unfamiliar with you as a medical professional, can you tell us a little bit about your background?
I grew up in Gibraltar, obviously. I went to medical school in the UK and then practiced mainly, did my training mostly in the UK, spent some time in Australia, and then trained to be an intensivist and an anaesthetist in the Manchester region, in the northwest region of England. Then worked briefly as a consultant as a cardiothoracic anaesthetist in Manchester for a short period of time. And then, because my first daughter was born, I wanted to come home so I moved back to Gibraltar. Worked backwards and forwards to the UK, did a stint back in the UK in Cambridge as well, again doing cardiothoracic and ECMO anaesthesia, and then moved back completely about 4 or 5 years ago, and have no intention of going anywhere again.
Dr. Hamish Thompson, thank you so much for your time.
Okay, thank you very much.
Thank you to the Critical Care Unit's Clinical Director, Dr. Hamish Thompson. He's also the GHA's Deputy Medical Director. This interview was filmed on the 10th of February. We have waited till now to share it as we wanted to bring you footage of the Critical Care Unit, which we received from the GHA this week. GBC is grateful to the GHA for filming this footage for us. Since the first week of January, we've been seeking access to film inside CCU and Rainbow Ward, COVID wards, the 111 call centre and also A&E to document the medical reality of the pandemic. GBC has been seeking permission to film inside the hospital since the 7th of January. In March and April, when GBC was allowed to film inside the hospital, we spoke to intensivists in the then empty COVID critical care unit. The staff's professionalism and that of other GHA staff shone through in our reports. As the worst of this deadly surge passes, Gibraltar's public broadcaster hopes to speak to more doctors and nurses about how they have coped with the pressure, as well as the no doubt excellent care our hospitalised COVID-positive patients are receiving. The coronavirus pandemic is the biggest news story GBC has ever covered, and we feel a sense of responsibility to you, the public, to show you the reality of COVID-19, including what's going on in our hospitals. Viewpoint will be back at the same time next week, but for now, thanks for watching, take care, and good night.